We could all use a little help sometimes. All of us. What do I need? Coaching or therapy? We'll get into that today at Live on Purpose TV. So do I need therapy? Maybe some coaching? Which one? What's the difference? What? Coaching or therapy? Okay, there are differences, and I think it's important to understand those differences as you make a choice about that. Probably it's helpful to start with a basic philosophy of where we're starting from in the first place. Okay, so if you think of your mental health on a continuum or a spectrum, there's two ends to this spectrum. So over here on the left end is the sick end. So that's where we have diagnosis, pathology, treatment, all of those fun things are over here on this end of the spectrum. What's on the other end? To understand that end, let's go to the middle first. So the middle, right here in the center of the spectrum, is what I call health. Health meaning not sick. That's all we're going to use to define health at this point. So not sick. You could be sick in bed with a fever, throwing up. There comes a time when you can get out of bed and you're not sick. But that doesn't mean that you're truly fit, thriving, prospering. That's this end of the spectrum. So if we look at the entire spectrum, that's going to help us to understand where therapy and coaching might fit in. Taking this end of the spectrum first. Now, I practiced in this end of the spectrum for about 13 years. In my career, I had a traditional psychotherapy practice. This is where I brought in my clients. I would give them a diagnosis, and by give them a diagnosis, I mean I would identify a diagnosis. What condition do they have? What illness or mental illness is going on over here on this end of the spectrum? Is it depression? Is it bipolar? Is it schizophrenia? What's going on over here? That was the diagnosis part. And then for that diagnosis, we come up with a treatment plan. The treatment plan is to address the symptoms and the problems and the difficulties that are being caused in a person's life as they're on this end of the spectrum. That might include medication, therapy, which is what we're talking about here today, other kinds of interventions that might assist that person to move this direction. The insurance companies would pay the bill for that typically, as long as the diagnosis was appropriate and billable, and as long as there was a good treatment plan in place that had been evidence-based and shown to be effective in moving people across the spectrum to this middle area. Now, when you hit the middle area, which I defined as health, meaning not sick, that means there is no longer a medical necessity for therapy because there's no longer a diagnosable condition. So a lot of this is driven by the history of where psychotherapy has come from. And this came from basically a medical model. So think about in the field of medicine, and I've compared it also to physical health. You know, you could be sick in bed, fever, and that you can get out of bed. Well, in a similar way, in the medical field, it's based around diagnosis and treatment plans. So that's what we're talking about in the therapy dimension. To practice in this field, in this side of the spectrum, requires education and licensure and all kinds of hoops that people have to jump through, because the license not only shows that they are credentialed and trained to work in that area, but also that it's set up as a protection to the consumer, because people who are receiving these services are deemed or defined to be vulnerable. So, and that's maybe more information than you wanted, but therapy is a licensed activity that is performed by professionals who are both trained and credentialed to act in that part of the spectrum. So now, what about coaching? I'm going to put coaching over here on this end, because a coach or a consultant or a life personal development professional is not necessarily licensed to diagnose and treat illness, for example. In fact, they are not licensed typically. I'm a licensed psychologist. I can work in this end of the spectrum, and I did for about 13 years. I have moved my practice over to here, where I do personal development and life coaching. Even though I am still a licensed psychologist who could practice on this end of the spectrum, I've moved it over here for a lot of reasons that are personal to me. But let's talk about what this end of the spectrum means, what it is. On this end of the spectrum, notice we're not so worried about pathology and treatment. We are more concerned on this end of the spectrum with skills development and enhancement of life and productivity and happiness. That's all on this end of the spectrum. And it's not medically necessary because we crossed the border from sick into not sick. So when you ask the question, do I need therapy or do I need coaching? I think the word need is part of the revealing factor here. If you need it, it might be therapy. If you want it or desire it, it might be coaching that you're looking for. Now, there's some upsides and downsides on both ends. Obviously, on this end, we're going to be dealing with diagnosis and treatment plans, and the insurance company is more likely to pay for what's going on this end of the spectrum. They will not pay for this end of the spectrum, typically, because it is not medically necessary. I haven't seen insurance plans that cover personal development coaching. I just don't think it's a very common thing at all. So on this end of the spectrum, you're going to be paying out of pocket, typically. Now, there's another thing that we run into with coaching. And I'm sharing this with you both as a warning and as just information. Because it is not a licensed activity, you don't have the same protection that you have on this side of the spectrum, because these people haven't necessarily gone through any particular training or credentialing or licensure that says that they're qualified or at least meet certain criteria to address the issues that you might bring to them. That can be an upside or a downside depending on how you're looking at it. I just want you to be aware of that, because anyone can set up a shingle that says, hey, I'm a coach. I'm a life coach. Okay, awesome. What's their credentials, their training, their experience? You don't know. You need to be able to answer that question if you hire them. Over here, you've got some assurances that that person's probably been to school, they've at least taken a test and paid a fee with the state to be licensed to do what they say that they can do. So hopefully that clears up some of the difference between therapy and coaching so that you can make a determination of which side maybe is more appropriate for you. And there's a lot of overlap in the middle. Can I just acknowledge that as well? There is a lot of overlap right here in the middle of the spectrum. I have found, for example, that most human beings are experiencing things that I would consider to be right here in the middle of the spectrum. I'm talking about some common things like depression, anxiety, relationship conflicts, life purpose questions. Those kinds of things are very, very common here in the middle of the spectrum. It doesn't necessarily mean that you're sick. It might mean that you're human. Welcome to Earth. That's how we roll here. So in either category, in the therapy world, a lot of people who are kind of on the milder end of diagnosis or aren't on the severe ends of mental illness will still benefit from therapy because those principles can apply to them. In a similar way, people in this middle of the spectrum could benefit very greatly from coaching, where there are principles that are applied that can help them move through some of these kind of middle of the spectrum difficult things that they're experiencing onto something much greater and much better than whatever they had before. Either way, if you choose the therapy route, if you choose the coaching route, I think it is extremely important for you to be discerning and to hire carefully. Remember, your therapist or your coach is working for you, not the other way around. I understand that traditionally the therapy end of things deals with a more vulnerable population. And a lot of times that creates some dependency between the therapist and the person who's being counseled. We want to watch out for that, okay? Because you are still in charge either way. This person is working for you, not the other way around, and you may fire them at will. I tell all my clients this in our first session: you can fire me at will, because if I am not helping you to move toward that end of the spectrum, then I don't think I have any right to be involved on your team. That is my personal commitment to all of my clients. I think you can expect that. You can demand that from anyone who is on your team, a therapist or a coach. Be discerning. Make sure that that person is working for you, because you're the important factor here. Be discerning. Make sure that you've got good reasons to hire the person that you're hiring, that you resonate with their approach or with their philosophy, that their values are consistent with what it is that you're looking for in your own life and in your own family. Either way, you can get a huge benefit if you're humble enough to open yourself up to the services of professionals who can provide either therapy or coaching for you. And there are so many possibilities. There's a whole spectrum. We all could use some help, right? Coaching, therapy. Hopefully that helps to clarify the issue for you. I'm Dr. Paul. This is Live on Purpose TV.